Welcome and thank you very much for the opportunity to come to talk to you today. The title is relating to workforce, digital and practice. And in the next half an hour or so, I'll be describing the case for lifelong learning in professional development. For those of you who don't know me, my name is Sharon Levy. I'm part of the BCS Health Care Scotland, and I'm also part of Edinburgh University, the DDI Data-Driven Innovation program, and my professional background is nursing. When I trained some 30 years ago, the tools of my practice were a pen and a paper. We used to collect data through adding to patient notes at the end of the bed. We used to share information using the phone or the fax machine. And if I wanted to know about current development in my field of practice, I would go to the library to read the weekly journals that were published in nursing, and then had an opportunity to look at other journals for medicine and other professionals. And we have seen tremendous changes in the last 30 years. Some of it are driven by the technology itself. We now have technology which is cheaper, far more sophisticated, with processing powers beyond belief. And we have a very strong market and vendors who promote and push this technology to be used within the health domain. And again, I want to stress that my background is health, but this talk is about health and care, as is the title of our program, the BCS Health and Care in Scotland. So just to focus on the drivers for this change, we talk about technology, but there's also other drivers such as the fact that we celebrate that people live longer. They live longer and they have more complicated care needs. And we're now looking at global health, something that impacts one locality, very easily spread across the world, as we've seen with the pandemic in the last couple of years. And when I was preparing for this talk today, I wondered what is the latest workforce numbers in health and social care, being mindful that those working in the National Health Service are, the numbers are less than those who are working in social work, social care, and ALUs. But what is the exact number? So I asked Siri. to tell me what is the current number. And she did. And then I asked AI to give me a depiction of those numbers. And I got two pictures. And I thought, isn't that great? It's not perfect. You know, the numbers are not necessarily came through as coherent, but it's so easy now to do so many things using technology, using artificial intelligence. And then I asked about professional development. What do you mean by professional development? And I looked at Copilot. At the university, we have access to Copilot, which is ChatGPT 4 or 4 point whatever it is now. And Copilot told me that there are 5 strands to the idea of professional and the idea of professional development. And to be a professional, you have to go through specialized education and training, and then have the expert knowledge. And to have an expert knowledge, you have to have a formal education and practical experience to make you an expert. A professional is also bounded by ethics. So there is a code of conduct which you need to adhere to as a professional. And the third point that was suggested by ChatGPT is commitment, which is at the heart of the talk tonight. It's about the dedication that professionals have to their work and to continuously seeking to improve their skills and knowledge. There is a sense of accountability that professionals are responsible for the quality and the safety of their work. And there is a recognition element, and the BCS is part of that ecosystem where recognition is identified. We are a professional body supporting, making sure that IT is working for society, is good for society. So this is part of the ecosystem that we're working in. And reverting back to my experience as a practitioner, here are some examples of certificates or completion of a CPD, one of which is from the FedIP, the umbrella organization where the BCS is part of, and they have a wonderful opportunity or wonderful resource for you to explore, to enable you to dive into further learning opportunities under the banner of the FedIP. I asked Siri, I asked AI, what is the current numbers in the National Health Service supporting patients, and in social work, social care, and early years governed by the SSSC, and I'll talk about them in a second. And Siri gave me the numbers. They gave me the numbers from last year. And moreover, I asked for it to be depicted in an image, and I got it here. And not foolproof. There's some problem with depiction of numbers, but tremendous progress in the availability of data, in the ease of use. And here is the outcome. Really impressive. And then I ask, if I'm thinking about professionalism and continued professional development, let's ask Copilot or ChatGPT-4 about what it means to be a professional or what is professional development. And Copilot gave me 5 strands. They said that professional refer to someone who is engaged in a specific occupation. And for that, they need to have expertise. So the person with the expertise had to go through formal education and practical experience, making them an expert in their domain. A professional very often need to abide a code of conduct and ethical guidelines. And number 3 here is really the focus of this talk. The professional has to demonstrate commitment and dedication to their work and continuously seeking to improve their skills and knowledge. There is the issue of accountability about the quality of their work, and there is recognition. And that's where the BCS, the British Computer Society, and our small community of practice in Scotland, we are part of this recognized professional body, and our work as volunteers support the recognition of our professionalism, our domain, and support others who follow our path or join the team, as happened tonight. So this is Copilot telling us a little bit about what it means to be professional and how professional development encompassing 5 strands. When I'm thinking about my own continuing professional development, and again, I need to emphasize that my professional background is health. I'm looking at some of the opportunities that I've got to develop my practice. So continuing professional development is any activity that promotes learning and development and enhances the person's ability to practice safely and effectively. And indeed, in the literature, the idea of safety, accountability, effectiveness is very much at the forefront of describing what continuing professional development is. Ross in 2013 suggested that CPD aims to sustain competence, introduce new skills, and Poole gives us a definition that CPD is a lifelong process of active participation in learning activities, supporting achievements of career goals. And I think I'll go back, I'll emphasize the last point here, that CPD promotes a greater appreciation of the implications and impacts of person-centered, safe, and effective evidence-informed care. And that's the goal and the focus of my practice as a clinician, as a practitioner. We actually engage with the members of the BCS, and Katie led the effort, which was published in the British Medical Journal, Health and Care Informatics, and I would encourage you to have a look at that. Part of your professional development, following a reflection on tonight's talk, I would urge you to look at the paper that was published in March 2022. And I think our impression was that it's complex. If you look at some of the professional titles of the people who may be potentially members of the BCS, we saw some 32 titles, each associated with one of 9 regulatory bodies, and each have a different CPD cycle ranging from 1 year to 5 years. So in terms of standards of CPD and what is required by a regulator, by a professional body, there isn't anything like that in the UK at the moment. And the market itself is saturated with different titles and different requirements. So the bottom line, it's complex. It could be made easier, but it's the thinking around professionalism and what is required to ensure that we remain safe, protecting the public, and safe in terms of delivering excellent professional services. I must stress the critical role of the Scottish Social Services Council in safeguarding and regulating the workforce. And they just had a change to their continuous professional learning, CPL rather than CPD, coming into place in 2024 in June, I think. And bluntly, practitioners are required to engage in continuous professional learning. It's a requirement by the regulator. So each year, as registered as somebody who's being monitored or regulated by the SSSC, the practitioner need to engage in continuous professional learning. And what I like about that is that there is a requirement to cover some form of trauma learning for both child and adult protection. And I think that is remarkable. And I think it will be helpful for health to follow the kind of path that is giving to us and think about trauma as a very impactful way of thinking about our practice, something that we need to be aware and cognizant in how it impacts the quality and the implication to practice in health and social care. Kings et al. Offered us a really interesting paper. And again, if you're interested in the references, please send me an email and I can share the references as part of a CPD development. They were looking at factors that optimize the uptake or the impact of learning as part of continuing professional development. And motivation became or was highlighted as a theme to optimize impact. And they're suggested that relevance to the role and desire or the projected career progression in terms of engaging with CPD is critical. You need to do something that is relevant to what you do and what you want to do in the future. It has to be relating to your own career aspiration and plans. There has to be a desire to deliver high quality of services. And I use the word desire here specifically because it has to have some kind of a desire, a burning urge to deliver high quality services. And I'm sure everybody that goes into the serving the public and through the services of health and social care have this desire. And then there's the willingness to learn. And that is not a given. Some people are coming to the profession because they are motivated by the desire to provide quality of care. And then there is this hesitancy, this resistance to learn. And that's something we need to work on and ensure that people are willing to learn. But it's not just about the individual, it's the whole ecosystem. And it's about having a supportive culture that values learning. Because without that, you will be an outlier by being a busy bee learning away, but the organization doesn't acknowledge or reward you for it. So I think we have to have a supportive culture, valuing learning, development, and improvement in practice through evidence-based practice. There has to be some alignment of the CPD that is offered or accessed with the organizational priorities. If you're interested in Greek mythology, that's great. But if you are a consultant pediatrician and you are interested in Greek mythology, there's not much alignment between the CPD of mythology and your actual work. So we have to think of how to align with your own progression and that of your organization. And that's the smart thinking of how to do the alignment there. And if you got the alignment and you've got a supportive culture, the organization has to support you as an individual and have to understand that learning is important for being an agile environment, having the adaptability to innovate through learning, support, and impact. And again, it's not just about you, it's the ecosystem that you're working in, including the organizational support. I think the author suggests that strong leadership and role modeling is important to follow a path. So if your line manager keep on demonstrating how their learning and development impact on their own development and their view of the environment, there is a correlation between their role modeling and their aspirational leadership style and the implication to the rest of the workforce. So that's something we need to think about, of targeting leaders who can then demonstrate the impact and the value of continuous learning. I think the next bullet point is important. It's even critical, but it's very difficult in this climate of today's work environment. I think there has to be adequate resources of time, staffing, admin, and finances to enable people to take some time off and dedicate to learning. Because if you really want to have the time to think clearly, to reflect, and to have the opportunity to impact on your environment, you need to be enabled, you need to be unleashed, and that's including giving you the time or paying for your CPD opportunity. And that is difficult, it's getting more difficult, and I'm not sure how easy it's going to be in the near future. We talked about time, staffing, admin and finance, and remuneration of hours. If you are working and you are doing it through learning, you need to be compensated for that. And again, that's not easy. And I know from the experience of working with CPD students that finding the time and having somebody to pay for your role, to pay for your learning is not easy, but I think it's a critical requirement. And there is also what Kings et al. 2020 found, that there is a strong relationship between employers and academic partners. So if your employers is aligned to a specific academic partner, and there is evidence and there is impact and there is a real sense of partnership, it's easier then to approach and engage with the workforce or engage with that specific employer, a specific academic partner, or other partners that relate to education provision. So these are the factors that were highlighted in that specific paper. And I think there's a lot to think about when we're thinking about our own attributes and the environment we work in terms of getting ready for continuous professional development. We're at Edinburgh University at the Usher Institute where I work. We have close relationship with NHS Lothian, and part of the DDI, data-driven innovation, is looking at the southeast of Scotland. And when we thought about the CPD path and the strategic alignment, we wanted to target a number of key stakeholders. That's including professionals like nurses and medics, social workers, social care professionals, but we also wanted to have the regional colleges and those who just finished a course and thinking about a career in a caring profession. How can we align them or attract them to think about care as well as data-driven innovation? And we also target third sector charities and the industry. We really want to have inroads into industry, and I'll talk about some of the challenges of thinking about the future worker and the future work and the employers of the future. We looked at a CPD model that has evaluation, reflection, planning, and action as a cycle within it, and thought about things like qualifications, the organizational culture, different frameworks of education, professional bodies input. And then we created a whole system idea where we've got the service user at the center. And for me, as a clinician, the service user is very much the person I support and care for. As a educationist, an academic, the service user could be my student. And then the circles are the organization, the professional bodies, the partners, the learning cultures that we talked about. There are things like research and funding that are coming into our ecosystem then. And then are circling around it, the data-driven innovation element, and how do we really change the mindset to say, if you're thinking about people and care and health is very much a person focused ethos or the focus of the work is the person themselves, how do you suddenly think about data, information, and knowledge as a core tool, a core element of your day-to-day work? How do you do that? And we crafted a number of pathways to think about the different clients or the different people that we need to target, and created some personas thinking about the pathway and how do we attract the right people. So we're starting with preparing for practice people who just completed their secondary school, thinking about what to do next. How do we attract them? We're talking about people who are aspiring to be professionals. So they are the student nurses, the student social workers. What kind of input and when do we need to have for those aspiring professionals? People who are already in the field working. How do we enhance the learning through practice? Those who are in a different level within practice that can apply their learning to make impact, how do we reach them? And then shaping evidence that both research and policy, how do we reach that level and offer the education and continued professional development that fit their needs? So we can't have one size fit all. Apologies. And then we created a pathway starting with the bite-sized learning. We crafted over 10 bite-sized learning of 1 hour of learning. Simple, you consume the learning quickly. There is a test and you get a certificate, a CPD certificate. We move on to the MOOCs, the massive open online courses that are free without a certificate. Again, a great opportunity to democratize learning, to enable more people to have access to it from all over the world. The CPD unit, I'll talk about it in a second. We've got digital badges. We have digital badges through our collaboration with the SSC. They have their own digital badge platform, but Edinburgh University is now engaged with Badger, and we're creating our own digital badges, and you will be able to seek further information through exploring that in your own time, and if that's what you're trying to look at. The micro-credential, again, it's interesting how you can curate your own learning, collect and collate learning elements, and then craft a specific entity or learning designed to support your own learning and get credit for that. So micro-credential is a different way of thinking about the curation of different learning elements into a package that makes sense to you with your professional development and career. And then under qualification, we've got the route to postgraduate, certificate, diploma, full MSc, and soon we will have a PhD pathway for the data-driven innovation as well. And again, I'll be happy to answer any questions, and there's further more information about what we offer. I don't want to be specific to one entity like Edinburgh University. I want to use it as a case study. So here is one of our flagship courses entitled Health Data Science. This is a course geared at a master's level. So you have to have a first degree to gain access to that kind of course. It's accredited by the Federation for Informatics Professionals. It's a 10 credit at the level 11. So just to clarify that, to get a certificate, you need to get 60 credit. To get a diploma, you need to have 120 credit. And to get the full MSc, you have to get 180 credit. So this is one chunk of 10 credits. And it's over 10 weeks. So it's quite long, intensive, require a lot of dedication to learning, but you're starting from scratch, and it giving you insight. And you can see some of the feedback there from people who were able to use this course and start a new career path. Really impactful. We have lots of examples of how impactful that specific course was. We benefited from the Scottish Funding Council for the last 5 years, and suddenly that funding ended, but there is still some money in the pot to support people who are who want to do that and fit the criteria. And again, that further information is on the website. We have other courses, for example, data ethics. So this course will help you to understand the ethical issues of collecting and managing data in health and social care. Through a combination of independent learning, online activity, guest seminars, and written assessment, you will be introduced to some of the key principles, concepts, and debates relating to data ethics in health and social care. This, in health and social care, is our unique selling point. Everything we do in terms of the content around data science has to have this health and social care. We are relating the theory and the content to the domain of health and social care. User-driven service design. Again, thinking about the user at the center as an example. Data standards and core technologies. Now, these may sound really exciting for some of you. They may sound very scary for others. We are offering a whole range of courses as CPD to give people an introduction, and if they want to know more, they can veer and craft, as I said, craft a pathway that is more attuned to standards rather than the clinical practice, as it were. System thinking, student feedback on that one is interesting. The course was fantastic. The quality of the resources and the presentations were great. The video and books were clear and inspiring. It introduced very important concept easily in a concise way. It's easy to see how I could apply this to my work. And the application, it's the idea of having the time to think and having something that you can take and apply to work, which is really important. Big data analytics. I'm just going through some of the core courses that we offer. Health and social care delivery and organization, which is more of an introduction to the systems of health and care, introduction to software development, data viz, databases, information systems. Some of these 10 credit courses at the level 11 at the master's courses, we were able to cannibalize and create a bite-sized learning. So from a 10 credit course, which requires 100 hours of learning, we were able to capture specific elements and package it as a 1 hour of bite-sized learning. And that's free on the FedIP. So again, if you're thinking about your own professional development, the Federation for Informatics Professions, which is the BCS is part of it. It's an umbrella organization. They have a wonderful learning portal that is free for the first 6 months. And if you are a member of the BCS, you get access to it too. Digital technologies, data security and protection, which is in high demand. Python, implementation science, again, linked to health and social care. working with data types and structure. We're getting into the more nitty-gritty of data science, and Python and R combining both languages. And there is a little bit of a stepped approach. Once you've got the foundation, you can build on different CPDs, the different pathway I was talking about. And the last thing, the last example is the 2 CPD courses that are not aligned to a master program, but really are offered to anybody who have the desire to learn more. So we've got evidence-based practice in the digital age, and we've got the system of digital care. The prices, as you can see, are much lower than the MSc program. It's a self-directed pathway, carefully crafted, so you have the scaffolding to enable you to understand and progress within the course, within your cohort, and have an opportunity to collaborate with others as well. So the evidence-based practice is really thinking about how to use digital to acquire critique evidence, and the systems of digital care gives you a whole perspective of the nuts and bolts of shifting into digital, thinking about things like interoperability, things like security, requirement in terms of ethics. So it's giving you a curated pathway to grasp the core element of systems of digital care. I want to just move on from the examples and some of the ideas of how to capture the desire to progress data science in health and social care to look at the future. Future gazing, education and workforce development. And it's interesting that back in 2020, there was a suggestion that in a time where knowledge and skills need to be updated constantly, a 3 or 4 year degree course may not suit the currency required in many jobs and other forms of paid and unpaid work. I think that really is capturing the essence of where we're heading. We are not sure if we are really preparing the students that are coming through our system to work in the future workforce, to be the future workers where things are changing so fast. We talked about some of the challenges in the health and care system, but UK universities are under increased financial pressure, drastic reduction in recruitment of overseas students, and the fees that come with that. So we, as an education environment, need to think about delivering courses that are fit for purpose, fit for practice, future practice, and do it in a value for money. AI is accelerating automation, and demand for just-in-time and continuous learning is increasing from workers who seek to remain relevant in an ever-changing world. So those who are in practice but can see how AI could be a threat are looking to upskill and reskill using education as the mode to do that. But if we are looking at upskilling and reskilling of the workforce as a core future-proofing requirement, we have to create a learning pathway that needs to be adjusted to fit with the fourth industrial revolution. And again, this is a concept that I want you to look at and explore for yourself. We're now at the very much at the heart of the fourth industrial revolution. And if we're talking about the fourth industrial revolution, I want to highlight a fantastic paper by Schut and French back in 2019. And I think Tara French, we had her talking to us, Katie, this year, part of the papers. So this paper from 2018 talk about health and care 4.0. And the Care 4.0 focus on how better connected people and environments could help people to co-manage and use their own asset in the context of their own care circle and community. This co-production, co-management, asset-based approach is very much at the heart of the direction of travel and what Tara and colleague are calling the Care 4.0. They go further to suggest that it would enable personalized services, that are more responsive to care needs and aspirations, offering preventative approaches that ultimately create a more flexible and sustainable set of integrated health and social care services that support meaningful engagement and interaction. So we really need to think or embed the thoughts of the Industry 4.0 and the Health 4.0 in the care, the vision of care, which is much more about co-production, using the people's asset to deliver appropriate services. So if you capture and you are intrigued or want to know more about this idea, please seek the publication that looks at care, health and care 4.0. And finally, the last few slides are really relating back to what we had earlier in the year. Katie was telling you about the Derek Hoy Memorial Lecture, and Derek was an innovator, a nurse by background, who looked at enticing people to work together, looking at stakeholders in developing of innovation around technology. He was a unique person, and we were lucky this year in July to capture or listen to the thoughts of Suzanne Bakken, Professor Suzanne Bakken, who introduced us to the idea of the epistemic justice, the idea that you need to appreciate the knower. You need to entice or listen carefully to people who have the experience and knowledge, and look at the barriers to enabling them to speak and inform the way you do things, especially around data and information and knowledge and informatics. And one of the key statements that she made in her intriguing lecture, which will be available for the BCS Health Care Scotland website very soon, is that if you exclude people, if you don't have the mechanism to enable people to be heard, when you create the next generative AI that think about solutions, they will not be able to be informed by important data source that could change the outlook of how we do things. And that is a real risk that we as professionals working in this sphere need to address, need to be aware of, and need to be educated of how to minimize injustice. And I think that's my last slide, and it really echoes Suzanne's conclusion around the epistemic injustice and the fact that we need to listen to people. We need to be informed by those with the right knowledge. And I talked in the last 30 minutes, I talked about lifelong learning, about professional development, about epistemic injustice. We introduced the idea of care for all. And first of all, if you are curious, please go and look further into these segments, these concepts that I described. But I think we need to, as a conclusion, we need to include a wide range of stakeholders, those with different knowledge, in redesigning relevant learning for a technology-enabled care. Things are changing. Things are changing very fast in practice, and we need to be ready for them in education. And to do that, we need to include and have a co-produced content and learning for the future workforce. We need to consider different learning pathways for workforce upskilling and consider the synergy with the culture of the workplace. I emphasized it, and I'll do it again. It's not about the individual, it's the individual in the context of the workplace. And if we really want to change the culture and endorse learning as a driver for changing innovation, we need to think of the system change and how to enable people to unleash the talent through changing the culture of the workplace. And if we are focusing on developing stakeholder capacity for co-production, which is critical, we need to think about it in terms of translation and dissemination of data, information, and knowledge, which is our domain, and not really think hard about the human element, but also think about the non-human agents in mind. And that concludes my talk. Thank you very much.
That was fantastic, Sharon. Thank you so much. It's really, really interesting. We do have a question from Hitesh. We have developers that don't understand clinical workflow and clinical leads that don't understand health tech infrastructure. What's the best approach for someone like myself, a full-time surgeon and software developer, to tackle this horizon? Do we need to push a generation of clinicians towards being software developers, or do clinicians need to learn UX development?
That's a fascinating question, and thank you for that. One of the feedbacks we got from the health data science, or the introduction to data science course, and we had one of the people that was there in one of the first cohort is A&E consultant, and he was desperate to have the dashboard working for him. He needed to have a different solution to what he got from his technical people. And by doing the course, he was able to grasp the essence of the communication, the element that needs to be included, and how to explain and how to create the environment where you can have fruitful interaction, where both camps able to understand the view and the perceptions of the others. So communication is critical, but you have to have the language in order to understand and appreciate the different gazes or different perspective of stakeholders. And I think going back to the culture, having a way of a place where you can listen, a place when you can be heard, a place where the fact that you are a surgeon and I'm a software developer, we are on the same platform in terms of our desire to produce something that is fit for purpose, without egos, without it, just to create something that is useful for me as a practitioner and helpful for you as somebody who wants to drive an efficient and effective system. I think education is a key. I think finding the right course where you can both join will be ideal. I hope that makes sense.
And there's also clinical fellowships that work very well in the digital side too. But there's another side to it as well, isn't there, around we've known colleagues who get the digital, add the digital onto their existing health and social care profession, and then get a bit lost. They just end up feeling they're neither one nor the other. And that's another area that really needs to be tackled. And it's really that they've gone that extra mile with their CPD and others got to catch up. And their careers are at a different point.
That's a really good point, Kitty. And I think the BCS, our community, can be this a place where you can interact, you can share ideas. It's a safe environment, and where you can have a home. So if you are feeling a bit lost and you want to have someone to listen to you, or someone to bounce idea in a really safe environment without any connection to anything else, we can do it. We can have this ecosystem.
That was wonderful, Sharon. I know we've got a couple of minutes over, but thank you so much. Thank you everyone who came along tonight.